Hey, what's up, everybody? It's Kenny Lamons here with Medicare Millennials, the channel where we teach you guys how to build a large, successful health insurance book of business with a Medicare focus. And today I'm going to speak to all of you new or prospective agents, or maybe even agents who are thinking about adding health insurance to their lines, something they want to, a business that you may want to get into. And I'm going to talk about exactly what startup costs you can expect on the front end. So this will be very useful for those of you kicking the tires or considering adding health insurance to your business. So first and foremost, I want to let you know that we do offer coaching services. You can go to our website, MedicareMillennials.com, and there'll be a tab for you to explore that. And then also you can contact us through there. So if you're not really wanting to buy a consultation yet, but you just have a few questions, there's a contact form there. Email me your questions and I'll get back to you as soon as I can. So just to jump right into it, guys, here's the beauty of the startup costs in the health insurance space, okay? They're very low. Here's why. Number one, most of us are going to be working remotely, okay? So in this example that we're going to run through briefly today, we're not talking about purchasing a building or even leasing a building. Now, while that is, if you have the ability to do that, there are some pros to that. However, it's largely unnecessary for a new health insurance agent, especially in the Medicare space. I'll explain why shortly. Secondly, a lot of us are going to work with a low amount of leads or maybe even no leads. You do not have to invest in leads. While I do think it's a good idea to do so, if possible, you do not have to do that to get into this business. And thirdly, this is assuming no employees, okay? Now, many of us do choose to hire a VA or an assistant or a secretary or an appointment setter, but that's almost always going to be part-time, at least through the first couple of years of your business, so you're not going to have the cost of an employee early on. So what cost will you incur? So let's jump into the very beginnings of it, and that's just your licensing cost. So what would it cost for you to go from somebody interested in selling health insurance to a licensed, ready-to-sell individual? So let's jump into that first. You have to get licensed through the Texas Department of Insurance. And before you can go sit for that test, it's highly recommended that you take an online training class. Okay. And so this can be done from the comfort of your own home. This online test is not proctored. It's practice and preparation for the real exam. And that's going to cost about $199. That may be a little less with discount code, a little bit more with depending which carrier or company you use to do your test preparation. I used License Coach, but a lot of people use Kaplan, as well as there are many other vendors that provide this service. But I used a License Coach, and that is still $199. So you're going to go through multiple modules, take quizzes, and then take a final test, and that will prepare you to go sit for your life and health insurance exam. So another point here, if you're interested in selling health insurance, life and health in the state of Texas are lumped together into one license. Here also, whether you want to sell Medicare or ACA marketplace plans or both, those are encompassed under the health insurance license, okay? So I recommend you just go ahead and sit for your life, health, and annuity test, because those all are interrelated, and you'll find you'll likely want to be able to offer life and annuity products. It's all lumped in here in Texas anyway. But even if you're in a state that only does health insurance, go ahead and get both. The next cost that you're going to have, at least here in Texas, and this is for most states, is you're going to have to pay for your exam, which is about $50. Plus, you're going to have to pay for your fingerprinting, which that's going to vary, but you can go through Identigo. I'll explain how to get that information shortly. You're going to have to pay for your test, your fingerprinting, and your application. Mostly you can do that online application with a small fee, and that's going to be around $100 to $200, depending what state you're in. Now, here in Texas, it's pretty simple. If you actually just Google how to get a health insurance license in Texas, it'll pull up the Texas Department of Insurance website. If you go to your Texas Department of Insurance website and click Get Licensed, it will give you kind of instructions on what to do. And so it will talk about the test cost, the fingerprinting and the cost, and the application and the cost. And it will tell you that their testing is administered through Pearson VUE. So it will link you to the website for whoever your state uses to administer the testing. That's where you're actually going to schedule your exam. So go to your State Department of Insurance website, click on whichever tab is about getting licensed, and it will give you the vendors that they use for their testing and for any of their fingerprinting requirements. So like I mentioned, fingerprinting here in Texas through Identigo. I'm sure that's the same for a lot of different states. And your testing is going to be done through Pearson VUE and the scheduling of that. And then finally, the application, once that's all complete, you'll send that in on an online application through the Texas Department of Insurance website. The next cost that you're going to incur is called E&O insurance. So I guess not so ironically, insurance agents also need to carry an insurance policy on your business. And this is, sorry, my allergies this time of year. So E&O insurance is errors and omission insurance. So basically, if you mess up an application, you write down the wrong thing that ends up causing some type of financial loss to a customer, this insurance is going to protect you in case they want to sue you or you had an error and an omission. So every insurance agent for most carriers and most products are required to carry this. I go through a company called Napa E&O. Just Google it, very straightforward. There's several different options. If you're not going to sell annuities, you'll choose option A through the Napa website. If you're going to sell annuities, I recommend going ahead and being prepared to sell those. Then it's going to be option B. And that's going to cost you about $355 per year. There is an option to make I think about 50% down payment and then the rest of it monthly. But if you just pay annually, it's around $355 per year. And of course, that may vary depending what state you live in. Then there will be no further costs directly related to being able to sell Medicare plans or ACA marketplace health insurance. Because, well, let me take that back. With Medicare, you do have to pay for your AHIP certification. So to sell Medicare Advantage plans, prescription drug plans, I have multiple videos that are a deep dive on AHIP. Every single year I put out a video about that. You're going to pay anywhere, depending if you get a discount, but just go ahead and assume you're going to be paying $150 for your AHIP. All right, so that's the final licensing cost. At that point, you're going to be prepared to sell, but now there's going to be some cost associated with being able to get out there and sell, okay? One other final note, you got to do your AHIP. Watch my other videos on that. If you want to sell marketplace insurance, there's no cost to this, but you do have to get FFM certified, Federal Facilitated Marketplace. That's where the certification you need to sell these marketplace plans on the federal exchange, the marketplace exchange. Your upline's going to have to walk you through that, okay? I might make a whole video on that sometime, but there's no cost to it. It's just something that you've got to do. So you've got your online training, couple $100. Your testing, fingerprinting, and application, another couple $100. Your E&O insurance, $355 per year. And then your AHIP, which is $150. Now, there's two options at this point. You're going to know this information based on talking to your recruiter, your upline, your agency. You should have already discussed all of this with who you intend to place your contracts with as your upline by this point. You're either going to plan on buying leads every single month, week, or you're going to be doing some form of grassroots marketing. Okay, and I have multiple videos on this. I plan to do more, but that would be things like sitting at kiosks in CVS, Walgreens, Walmart, volunteering at food banks, setting up tables at senior centers, networking with doctors' offices and pharmacists, dentists' offices, local events, local leads groups, spending time up at your local community center or YMCA. There's various things you can do, grassroots marketing, that only cost you time and effort and don't require a substantial upfront financial obligation. If you go that route, you may want to set aside $500 a month for various expenses, but you're not going to have an actual obligation monthly that you need to budget for. If you go the leads route, I'm going to tell you realistically, even if you go with some type of subsidized Facebook or direct mail lead. One of the main questions you need to ask your upline or your FMO when you're researching this business is, what leads do they recommend and how much do they cost? But I can pretty much guarantee you're going to need about $2,000 or more every month to have any type of consistent quality lead every single month. Okay? So the whole video is not going to break that down, but you need to be prepared to have $2,000 per month every single month. It's not like, well, I'll spend this $2,000 and if I make $10,000, I'll spend another $2,000. In this business, you've got to be prepared and able to endure the first year, and consistently, if you go the leads route, be prepared to handle at least $2,000 per month towards leads. So that's probably the biggest expenditure right there. We don't have a lease expenditure, no employee expenditures. We're working remotely, but our biggest expenditure isn't actually getting licensed and getting our E&O insurance. It's actually our lead cost, or maybe our opportunity cost when we go out and network and do grassroots marketing. So again, those are things you're going to have to dive into deeper with your upline. And then finally, there's miscellaneous costs. So some of the miscellaneous costs that you're going to encounter are, if you're a field agent, so in other words, you mostly meet people face-to-face and sell locally, you're going to need some type of tablet. I personally recommend an iPad with an Apple Pencil. It makes it really easy to do online applications and gather any information you need, as well as to show the client any type of presentations. If you're a agent that's going to be doing exclusively telesales, you're probably going to want a nice computer or laptop and a headset. Well, that's going to cost you a minimum of $500, probably closer to $1,000 to get unless you already have that equipment set up in your house. You're going to need to buy business cards, so go ahead and budget $50 to $100 for business cards. And although you're having a website and a dedicated email address isn't mandatory early on, you can do that later. It's kind of nice to have it just for a little bit of, just to kind of prove that you're a real business. And you can anticipate spending maybe $20 a month to maintain a basic website on Squarespace as well as an email address. And then you don't have to have a CRM day one. But it's nice to go ahead and start out with something that you can keep track of any clients or prospects you encounter, manage your leads, and then, of course, maintain client data so that we can maintain these clients on our book of business for many years to come. The CRM that I use and highly recommend is Medicare Pro app. Okay, so just go Google Medicare Pro app. It's a great CRM. Does everything I need. It's simple enough, and it's about $50 a month, so it's affordable even for new agents. So I hope that was helpful. That should give you an idea of the potential startup cost to start a health insurance agency. I focus on Medicare, but I do also sell ACA plans, and that's been a big part of the growth in my business over this past year. So that's why I kind of, instead of just saying a Medicare insurance agency, it's a health insurance agency. So hope this was helpful. Y'all have a great day.